we don't have to go chasing waterfalls. Some of these things
Right.
are old. These are old methods, but they absolutely work. So spreading the word about any types of food initiatives like canned food drives can really push the word and get people to know about the things that are happening in their community and the things that they can do to help as well.
Hello, everyone. Welcome back to your Health Matters podcast. Today we have a very special guest today. But thank you so much for joining. Is it your first time? Thank you so much for tuning in. And yeah, we have a very special guest. Her name is Jillian. She actually worked for Sorogi. And so, yeah, welcome to the show, Jillian. How are you today?
Thank you so much. I'm doing well. Thanks for having me.
Of course, likewise. So, today our episode is really going to focus on nutritional barriers in underserved communities. And for you, you have amazing background in nutritional science, but I'm really curious, how did you get started in a field such as this?
That is a good question. I was raised pescatarian, first of all. My dad, he was vegetarian for about 30 years before I was even born, so he had made major life changes and really emphasized the importance of nutrition just in my household for me and my brother. On top of just being raised on taking ginger shots every morning, and he would have his drinking noni juice every morning, and I knew that was different because with the other kids that were in my school, like they really didn't, when I would talk about my experiences with how I would eat and my relationship with food at school, I knew that it was different because none of my other peers had shared those same experiences. So I was just like, okay, like maybe
Right.
my dad is really implementing the importance of nutrition in me and my brother in a very different way than most people are, or at least kids my age. That was one thing. And I feel like one of the reasons why he was so in tune with nutrition and why it was so important to him and important to instill in us was because he was diagnosed with prostate cancer when I was young. And on top of his therapy, his radiation therapy, he also hired a nutritionist. And with those two things together, he still attests to this day, because he's been in remission for over 15 years now. He still attests to
Thank
this
God.
day, right? That the reason why he got better was not because of the radiation therapy. It's because his body was able to withstand the treatment because of the changes he made to his diet. So that's why I
Wow.
started to really study nutrition and really hone in on why it's so important. And yeah, that's why I'm here today.
Wow, that's such an impactful story. And you are right. Nutrition has such a profound effect on us. And as we dive in and talk about the nutritional barriers, I'm just curious on your perspective with so much knowledge and experience, and even with your master's degree, what nutritional barriers have you seen in the community, and what do you think are the causes that cause a lot of the nutritional barriers that you have seen?
So many, so many. Number one, a lack of nutrition education, which is why I really thoroughly enjoy being with Sorogi, because that's a large part of my job here.
Right.
Transportation issues, lack of food quality, food deserts, or what I like to say is food apartheid, because there's nuances between the two. Food deserts, it kind of implies that it's a natural thing that nobody really has control over because deserts are natural resources. But food apartheid implies that it's intentional, right? So food deserts or food apartheid, whichever one you want to use, those are obviously areas with limited access to grocery stores, right? So that forces people or residents to depend on convenience stores and fast food restaurants. So for me personally, I grew up in Temple Hills, or in the Marlow Heights, Hillcrest Heights area. So I feel like I had a unique experience because I grew up in Temple Hills, but I went to Bishop McNamara High School, which is a private high school in Forestville. And most students, as far as I knew or could see at the time, they didn't really live in my area. They lived in Upper Marlboro, Largo, Bowie, Laurel, etc., right? So as I started making those friends and visiting them, I not only noticed how different their area looked. That's really when I really started in high school, when I really started to see the differences between the areas and the socioeconomic differences between the two. So I noticed that in their areas, they not only looked different, but they had different resources close to their homes or closer to their homes that was different than me. So they had the Whole Foods and they had the Wegmans and they had all the things. And I really started putting two and two together at that point, because I would say to myself, wow, my mom is always complaining about how we have to go across the bridge to Virginia to find a decent Whole Foods or a decent grocery store.
Wow.
So that's when I really started to say, you know what, there's something going on here. And I really started to dive deep into the concept of food deserts, because I didn't really know at the time, but that's when I kind of started connecting the dots. So not only have I observed it, I've lived and experienced it as well. So obviously these are super important and why we're here to discuss them today.
Yeah, you're definitely right. And, it's crazy how people have to travel so far distant just to get to like a healthy food area. And I know transportation is such a big issue, and also the education aspect. Not so many people really understand, how to have proportions of meals and how to get a healthier regimen. So, thank you for sharing that. And, to my next question, I'm really curious to know, what are ways that people can try to mitigate a lot of the nutritional barriers they have in their communities, whether it's distance, education, and so forth?
I feel like at the core, it's really a policy issue. So advocacy obviously is the first thing that I think of, but the main thing that people can do if they're not at a policy level, which a lot of people aren't, are just getting involved. Being able to spread the word and know where the Whole Foods markets are or the farmers markets are, being able to spread the word, especially in places like Ward 7 and 8 of DC, which is the main place that we're able to implement our programs. Being able to say like, hey, there's this nutrition program that I was able to be a part of. Are you able to join me on Wednesdays? Or the programs that I feel like we were talking about a couple weeks ago, that a lot of places that offer transportation incentives. Like if you were to go and donate a couple of cans, then you are able to get a transportation card or a grocery card incentive. So there are certain programs that are out there that are available for people to be able to mitigate some of these things. But I feel like that's one of the main reasons why I like being at Sorogi, because advocacy is one of the main things that we're able to do. And I like being able to go out into the community and really tell people about the resources that are available to them so that they don't have to undergo a lot of the pressures that they go through so often, at least.
Right. And to your point, I definitely agree. Sorogi has an amazing program. We have SNAP Ed. Do you want to talk more about that and what that program really brings people in underserved communities?
Yes, absolutely. So I've had the privilege of kind of manning the SNAP Ed program here at Sorogi. So this is an initiative that we're really trying to do three things. Number one, increase the consumption of fruits and veggies in SNAP-eligible residents, especially in Ward 7 and 8 of DC, but obviously the education is for everybody. Number two, increase sources of available and nutritious foods. And also, number three, increase physical activity for 1,500 SNAP-eligible residents. There are two parts of this program. Number one, we have the indirect education, where we go to locations like libraries and schools in Ward 7 and 8, and we connect with the community, pass out flyers on My Plate recommendations, food groups, portion control, etc. And a lot of the time we have free goodies as well. Like if you like to meal prep, we'll give you containers that are really nice for meal prepping and being able to really see what the best way to keep your portion control. So we have free goodies for that, and we also have games for kids. So if you want to come to one of our tables, you should definitely follow us on our socials so that you have more information. But that's our indirect education. And also, if you are interested in our direct education, where if you sign up for a three-part program, it's a three-part curriculum where the first class, which are all online, by the way, so you don't have to leave your home. But the first class is a nutrition education class, and then the second class is a cooking class. Third class is a fitness class. So if you take all three, and the max of them is like 30 minutes long, so they don't take much of your time. But if you finish all three and complete the curriculum, then you get a grocery card incentive. I've been very grateful to be a part of that initiative, and it's super fun to implement. So that's one of the main things that I feel like have been able to increase healthy foods in underserved areas.
Yeah, and that's really nice. I'm so glad that Sorogi started this program. But I'm curious to know, have you seen a lot of the impact in terms of people getting better, in terms of seeing better nutrition choices, in terms of the education aspect? And can you talk about any anecdotal experiences you have been able to see?
Yes. So For the main part, I think the indirect educate, because indirect is where we're actually in the community and talking to people, connecting with people, right? So it's a little bit different than direct education where it's more formal. You sign up, we're able to actually do check-ins with people. But I think that I'm able to connect with people more obviously with indirect. So after having connected with them and maybe exchanging information, or a lot of the time actually they'll ask me for my email, and if they have questions, can I contact you, X, Y, and Z. So the main improvement that I have seen is people contacting me after we've had a conversation once they visit my table, once we've set up for indirect.
Right.
And the main heartwarming things that I've seen is that people will contact me and say like, hey, I read this article about resistant starch and how that can increase the fiber in my diet and how that can increase the healthiness of my gut microbiome. Or, hey, I saw this article here and I wanted to share it with you. Maybe you can share it with your classes that you teach. Or, hey, I really enjoyed talking with you. You really helped me hone in on what I can do to help manage my blood pressure. Or, thanks for telling me to sign up for the diabetes management classes. So it's really those things where people will follow up with me and tell me about the things that they learned or the initiatives that they're planning on doing in the future just because they came by to visit my table. So yes, it's not super specific, but it's really heartwarming to see the things that people are so excited to follow up with me and tell me the things that they learned.
And I think that impact really goes a long way, because one thing I love about Sorogi is that we are journeying with you. We are with you with your chronic illness, and we're not trying to change anything about you, but really take where you are at and try to cultivate your culture, your traditional background,
Yes.
your way of life, and try to adapt a better approach for you to have a much healthier lifestyle. And I love how, you mentioned with Tana and a lot of her cooking classes, she incorporates a lot of the traditional cultural meals you'll see in a lot of the African diaspora communities. And I feel like that's such a great way to get people in tuned, engaged, and really remember a lot of the quick healthy tips that they can incorporate into their everyday life. So
Yes.
thank you for that. Really appreciate it. Yeah. And, to my point, I'm just curious to know, we talked a lot about nutritional barriers and a lot of the inequitable resources. One thing that I love that Sorogi also does is give out like blood pressure cups. They have great ways of tracking people's blood pressure and monitoring that aspect. In the communities you have been able to see in your time working with Sorogi, have there been any other initiatives that have been helpful in terms of reducing a lot of the nutritional barriers in the community?
There are a lot of stories while I was getting my master's, but because I did go to the University of Georgia, so that was very different from obviously having grown up here in Prince George's County, Maryland. While I was in Georgia, it was mainly, so University of Georgia is in Athens, Georgia, not Atlanta, which is what most people think. But it's a very, very, very very small town, about an hour outside of Atlanta. And it also has a lot of elementary and middle schools there. So some of the main things that the nutrition graduate students at the University of Georgia would do is implement a lot of food drives and canned food drives so that the kids in the area could not only learn about the nutritional barriers in their area, but also learn about the things that they could do as they develop to help other people as well. So some of the main things, and I feel like one of the most effective things, because everybody's always hearing about canned food drives, but those are some, we don't have to go chasing waterfalls. Those are some of these things are old. These are old methods, but they absolutely work. So spreading the word about any types of food initiatives like canned food drives can really push the word and get people to know about the things that are happening in their community and the things that they can do to help as well.
Thank you for that. And I definitely agree with you. I'm also curious to know more about the research. What future trends have you seen or even heard about or partaken in terms of the future development to help decrease nutritional barriers in the community?
I think one that's happening right now that I was just reading up on is a trend called food as medicine. And it's a movement that encourages nutrition, kind of like interventions to prevent or manage chronic diseases. So research also highlights the importance of, emerging research, I guess now, is highlighting the importance of gut health and how the gut is connected to your brain in a lot more ways than people think. Your gut is your first immune system and it's your second brain as well. So it plays a huge role in your overall well-being. So this research movement, I feel like it's leading more to emphasize fiber-rich diets in underserved communities as well. part of the reason why my research in grad school was so focused on how a maternal high-fat diet can impact offspring feeding patterns, and also it can impact your offspring's propensity to develop obesity. One of the main intervention methods that I was implementing in my research in grad school was how a prebiotic supplementation, and prebiotics is just a fancy word for fiber, it can also improve the outcomes of the deleterious effects of a maternal high-fat diet. So I'm excited to see how that field, or at least the field of research, grows, because it's lesser known right now, and anything without about 10 years or so of research under the belt is considered to be a new field of research. And I feel like the importance of gut health and how it impacts your brain can really propel the nutritional sciences movement, or any type of nutritional sciences research, into the communities to really impact direct community support and advocacy and education as well. So I'm excited to see where that goes.
Yeah, that sounds really interesting. Gut health, gut health is something I don't even think about as much. So to see it being an area of interest, especially for nutritional research, is really exciting. Really exciting.
Oh
So
yeah,
thank
we
you for that.
all fall short, because I was eating my hot Cheetos the other day. So everybody falls short and nobody's perfect. But I do feel like being able to know these things is really going to help us all keep them in mind just for the long term and moving forward.
Right. That awareness piece is really going to be helpful. Thank you. I also am interested to know more about the mitigating a lot of transportation and healthy food options. We talked a lot about how to remove a lot of the nutritional barriers in the community, but I really want to know regarding how people can get to a grocery store, how can people mitigate that area of resource, and really also really the healthy food options and how people can better select a healthy food choice.
Yes, there are a couple things. Number one, I feel like is not only effective but a lot more fun is making group trips to the grocery store. Carpooling with friends or family and just coordinating schedules to be able to go together is also good. Or you can take the bus or subsidized ride sharing. I feel like is a program that places like Uber or Lyft are also implementing now, so that a lot of people in underserved communities might be able to get the resources that they need. Or there are programs at community centers that if you complete a class or take a survey or anything that they incentivize at that community center, they give you a Metro card incentive or a grocery card incentives. Those are the ways that I've at least seen that people or community centers in general are at least trying to mitigate those transportation issues.
Right. That's really great. I think that's going to be really helpful for a lot of people, especially if they live far out from a grocery store, and having that aspect just because transportation is a hard aspect. I also really wanted to ask you really about choosing a healthier food option. A lot of times people choose food, as we discussed before, regarding kind of choosing a cheaper option or fast food just because it will fill you. But how can we try to control that in terms of people not getting a quick fast food or a quick cheap option just to help fill them for the duration of the time?
I feel like most of the time when it comes to the advice that I give people, it's essential to provide simple and cost-effective and culturally relevant solutions. So I emphasize staples like beans or canned fish or lentils or frozen vegetables if people are short on time and they're not able to actually cook very often. So obviously advising them to buy fresh veggies or fresh fruits wouldn't necessarily be the best thing for them. So frozen vegetables or dried fruits would still provide those essential nutrients without actually requiring refrigeration, so that can prevent quick spoilage as well. So time-saving techniques such as like meal prepping or like batch cooking, that really helps people avoid relying on fast food as well.
Right. Yeah, those are some amazing options, especially great ways to help people really avoid the fast food options. So thank you for sharing that. So how can people join that particular program as a whole?
The main thing that I would suggest for people to do is follow us on our socials, because our cooking demonstrations, we often post flyers at least a week in advance to let people know and plan accordingly. They're always every other Tuesday at 6 p.m. It's over Zoom, and on the flyer you'll get a QR code that will take you directly to the Zoom, but it's also live streamed from Zoom to our Facebook. So you can also access it on Facebook Live as well. So follow us on socials and you'll be able to stay up to date with that.
Nice, nice. Thank you. And thank you so much for sharing. I really do appreciate having you on, Jillian. It was a pleasure.
Yes, it was absolutely a pleasure to be here. Thank you so much for having me.
Of course. And thank you guys for listening. Please follow us on our Spotify, our social media. We're on Instagram, we're on Facebook. Check out our website to listen to the podcast if you're interested. And yeah, thank you so much. I look forward to hearing you guys soon. Bye, guys.
Bye.
Bye.